Hey guys, my name is Samantha Bernardi and I'm going to be discussing anosognosia and chapters 7 and 8 of Dr. Ramachandran's Phantoms in the Brain. Anosognosia means without knowledge of disease, and another term that we should probably get out of the way is hemiplegia, which is partial or total paralysis. And there are two theories that Dr. Ramachandran discussed. One was the neurological theory, and that purports that denial is a direct consequence of neglect syndrome, which is just the general indifference to the left side of the body, or the left side of the entire world, which would explain why people don't know that their limbs are functioning, because they just don't really care, because it's just not in their world. But this doesn't really explain why people are really adamant about the fact that their limbs are in fact working. The Freudian theory is that the patient simply does not want to confront the unpleasantness of his or her paralysis. But this doesn't explain why this defense mechanism is so exaggerated in denial patients, where they clearly see that their limb is not moving, and yet they adamantly say that their limb is moving, like my hand is clapping my other hand, or I am touching your nose while it is laying there lifeless. So one of the studies that I did was done by Court and colleagues in 2014, and it found that 75% of patients with anosognosia for hemiplegia had dysfunctional tissue in the pars orbitalis of the right inferior frontal gyrus, compared to a group of individuals who were unaffected with anosognosia for hemiplegia who did not have these abnormalities in these tissues. Their participants were people within the first 48 hours of stroke. And the right inferior frontal gyrus has been shown to be implicated in motor response inhibition and action planning. And it receives sensory input and responds to characteristics of stimuli in regards to emotional latency, leading to reward or aversion behaviors. And studies suggest that this region underlies body ownership and is involved in detection and resolution of various conflicting signals between internal representation and external representation of body-related events. And this study suggests that the right inferior frontal gyrus may play a role in awareness of limb functioning. And another study that I looked at was done by Rosen in 2011, and he looked at anosognosia in neurodegenerative disease and found that the frontal lobe is heavily involved in the development in anosognosia, or rather the lack of involvement in the frontal lobe is involved in its development. Their theory is that learning about change in one's ability begins with performance of cognitive and social tasks. Success or failure of a task is evaluated, which sometimes results in a change in self-image. Our performance monitoring systems are activated, and they compare our actual performance against our expected performance. Our self-awareness depends on our ability to actively monitor our performance in tasks. And studies have shown that lesions in the medial prefrontal cortex impair our ability for error correction, and that this may contribute to our ability to evaluate our performance. And the last study was done by Coccini and colleagues in 2009, and they looked at anosognosia for left brain damage. And in the book, Dr. Ramachandran hypothesized that the reason why we don't see anosognosia in people with left brain damage is that the right brain is kind of it monitors the environment, and that the left hemisphere of the brain is kind of what maintains the status quo. So the left hemisphere the right hemisphere reports to the left hemisphere when things are amiss, and the left hemisphere kind of either ignores it or doesn't. And this study kind of looked at how we diagnose anosognosia in patients, and that we use a structured interview, and people with left brain damage don't have the linguistic skills to do these structured interviews. So they used both a structured interview and a visual analog test for anosognosia for motor impairment, and they found that 40% of those with left brain damage showed evidence of anosognosia. So that's what I researched. Those were my summaries of the articles that I did. So that's all I have.